Hi viewers, today we'll see types of traction. I am Dr. Kaliselvi Xavier, Professor, Tribulum College of Nursing. Objectives of the today's class. At the end of the class, the students will be able to mention the meaning of traction, describe the purposes of traction, explain the different types of traction, specify the risk of traction and enumerate the management of patients in tractions. As traction is a pulling force in orthopedics, traction therapy is used as a conservative intervention. It is used to reduce and maintain alignment of fracture usually. Immobilize inflamed or injured joints, relieve pain, correct mild deformity, and reduce muscle spasm. Skin traction was one of the best management techniques in orthopedics. Currently, skin traction is primarily used in managing trauma. In advantages include preventing further displacement of the fracture and maintaining or improving alignment. This is the traction images, skin traction and skeletal tractions are there. Now we'll see meaning of traction. Traction refers to the practice of slowly and gently pulling on a fractured or dislocated body part. It's often done using ropes, pulleys, and weights. These tools help apply force to the tissues surrounding the damaged area. What are the purposes of traction usage? It can be stabilize and realign bone fractures such as broken arm and also leg. It will help to reduce the pain of the fracture before surgery. It is used to treat bone deformities caused by certain conditions such as scoliosis, etc. And also it will be helping for the correct stiff and constricted muscles, joints, tendons and also skin. And also it will be used to stretch the neck and prevent painful muscle spasm. These are all the some of the images. Bryan's traction, bust extension, Thomas splint tractions, suspended or floating traction, etc. This is a balanced suspension skeletal traction with a Thomas leg splint. Now we will see detailing about different types of traction. There are the four main types: skeletal traction, skin traction, cervical traction and also spinal traction. What is skeletal traction? The skeletal traction involves placing a pin, wire or screw in the fractured bone. After one of these devices has been inserted, where weights are attached to it so the bone can be pulled into the correct position. This type of surgery may be done usually with general anesthesia or spinal or local anesthetic. Because of it, the patient will be kept relieved from pain during the procedure. Then we'll see skin traction. Skin traction is a far less invasive than skeletal traction. It is also used applying splints, bandages or adhesive tapes to the skin directly below the fracture as it's shown by in the picture. Once the material has been applied, the weights are fastened to it. The affected body part is then pulled into the right position using a pulley system attached to the hospital bed. Then we'll see cervical traction. During cervical traction, it is a metal brace is placed around the patient's neck. The brace is then attached to the body, harness or weights which are used to help correct position for the patient affected area. Cervical traction is performed using a general anesthetic, so the patient will be asleep throughout the entire procedure. and we'll see spinal traction. The spinal traction is a form of decompression therapy that relieves pressure on the spine. It can be performed manually or mechanically. The spinal traction is used to treat herniated disc, sciatica, degenerative disc disease, pinched nerves, and also many other back conditions. Spinal traction stretches the spine to take pressure off compressed discs, so it will be straighten the spine and improves the body's ability to heal itself. Then we'll see what are the risk of tractions when we are using. Risk involved in all surgical procedures. The first risk is due to adverse reaction to the anesthesia. Then excessive bleeding, an infection of the pin site, damage to the surrounding tissue, and the last complication or the side effect is nerve injury or vascular injury from too much weight being applied. Then what is important to contact the doctor? When it is a prescribed medication, it's not relieve the pain. Patient continuously saying the pain means we have to inform immediately. Then skin around the pin site becomes red, hot or swollen, or the patient is having drainage. Continuously we have to monitor and inform immediately to the physician wherever necessary. Is traction on effective treatment? Yes. Okay, the traction used for considered state of the art treatment. Recent years, the surgical techniques have become more advanced, more effective in correcting fractures, damaged muscles and spinal condition, even though it does not allow for much movement after surgery. So the recovery time is often much longer. Today it is used primarily as a temporary measure until the definitive procedure is done. Traction saved many lives during World War II by allowing soldiers to be transported safely without injury to their surrounding tissues. However, traction can be beneficial in treating certain conditions. It is very effective in providing temporary pain relief in the early stages of treatment after trauma. Now we'll see nursing management of patients in tractions. What are the assessment to be done before applying to the traction? The nurse shall perform neurovascular, sensory, motor assessment and also document as ordered. And she has to see what are his needs and what are his limitations. The nurse shall determine whether the activities of the patient can do himself or any requirements of assistance or the basic consideration or nutritional needs, hygiene, elimination needs and needs for some sort of diversional activities, everything to be assessed. The nurse shall notify the physician immediately of any acute changes in sensation, movement or neurovascular status. Then we'll see role of nurse in caring for patients in traction. The nurse shall not apply or set up skeletal or cervical traction. The nurse shall not remove, add or lift up on weight when the patient is in traction for the treatment of fractures. The nurse may remove or add weights to balance suspension, example slings, which is used with skeletal tractions. The nurse shall not release a patient from traction for the purpose of transfer to and from bed, stretcher or procedure tables. The nurse shall notify the physician so the physician may come and remove traction for transfer and to replace traction. The nurse shall provide pin care per physician order. What are the maintenance of the traction apparatus? The traction apparatus shall be maintained at all the times so that the alignment of pull is correct. If traction is not in alignment or there appears to be a discrepancy in the number of bounds, The nurse shall notify the physician. The nurse shall document in the quick note. The nurse shall document the number of pounds of traction every 12 hours. The nurse shall check the traction apparatus to verify the following are allowed. Ropes are unobstructed or not in contact with the bed or equipment and move smoothly over the pulleys and the weights or hanging freely. This is the like easy understanding the traction. The T means temperature, or ropes hang freely, A alignment, C circulation check, T type and location of the fracture, I increase fluid intake, O overhead trapeze, and no weights on bed or floor. Then we will see care for patients in traction. The first care is when assisting with the AM and PM care, encourage the patient to do as much for himself as it possible with the constraints of his immobilization. We have to encourage him to do small activities because due to the pain or the depression they will not do any activities. We have to encourage and mobilize, assist with or perform those tasks that the patient cannot perform. The second, nursing care, assess the patients under the traction setup to determine the best method for changing the bed linen. There are several acceptable methods for making an occupied bed, and depending upon the type of traction in use, patient will want to use the method that is easiest. For some patients, head to toe technique may work better than side to side. Always be sure that the linen is smooth and dry. Utilize draw sheets when appropriate. Reposition supporting pillows and change the pillows cases as often as needed to prevent the patients from being supported by soiled, damp, wrinkled, or flattened pillows. The third care, when assisting with the bedpan or urinal, provide adequate time and privacy for the patients. Very important. Many patients do not adjust easily to the awkwardness of using a bedpan or urinal. The presence of roommates, visitors, or hospital personnel just outside the privacy curtain is enough to make anyone uncomfortable. Always place toilet tissue, moist towelettes, and call bell within easy reach. Check daily to see whether the patient has had a bowel movement. Treating constipation will prevent the more serious problems of fecal impaction. Physicians will routinely prescribe a stool softener for immobilized patients in order to prevent constipations. The fourth care, encourage the patient to eat all the prescribed diet. If permitted by the physician, suggest that family and friends bring fruits or a healthy favorite food from home. A recovering patient's diet should be high in calcium, protein, iron, and vitamins. Plenty of fluids and foods high in roughage will help prevent bowel and bladder complications. Fifth care, assist the patient to take several deep breaths each hours. Coughing and deep breathing exercise will help prevent respiratory complications. Encourage the patient to actively exercise the unaffected extremities. The sixth care, eliminate any factors that reduce the traction pull or alter its directions. Ropes and pulleys should be in straight alignment and the ropes should be unobstructed. Traction is not accomplished if the knot in the rope is touching the pulley or the foot of the bed. The weights must be suspended or not in contact with the bed or resting on the floor. While the patient's body should always be in alignment with the force of traction, check the patient's position each time while enter the room and help the patient slide up in bed if necessary. Encourage the patient to use the overhead ribs instead of elbows to move in bed. Seventh care, check the extremities for color, whether it is a pallor or cyanosis, numbness, edema, sign of infection, pain. Look for areas of skin breakdown or the presence of on all skin surfaces to be assessed. The eighth care, orthopedic patients confined in tractions will need some sort of diversional activity to relieve boredom and prevent depressions. If patients' treatment facilities has no occupational therapy department, encourage family and friends to visit frequently and bring books or games for the patients. Television and radio may also help to pace the time. The nursing personnel should make opportunity to stop the chat with the patients, both to distract the patients from boredom and to assess the patient's mental status. It is often easy to see a state of depression beginning, and it will be easier to dispel in its early stages. Then at end, care of patients in cervical traction. The cervical traction, the nurse shall do the following steps. The first step, verify that the head of the bed is adjusted per physician orders. Then the two, verify that suction is available at the patient's bedside. The third one, when conducting cardiac pulmonary resuscitation, use jaw lift maneuver. Specifically for the cervical tractions, this to be jaw lift maneuver to open the airway without hyperextending the neck, so that the realign patient horizontally if head of the bed is elevated and put board behind patient's neck. The fourth care, if the patient requires log rolling, the RN or the nurse or licensed practitioner shall direct patient's movement from head of the patients. The fifth one, the patient shall be turned every 2 hours per physician order, wherever necessary. The skin shall be assessed with each turn for evidence of pressure, paying close attention to the occupational area, any bony prominences, tractions, sites. Thank you for patient listening. These are all the references.